If you're watching this, most likely you're about to have a minimally invasive lumbar spinal fusion. This is the speech I give every patient right before they're about to have a minimally invasive lumbar fusion. My first point is, it is minimally invasive, but that does not mean you won't experience some pain. Unfortunately, I have to start out by scaring you just a little bit. The first time you stand up, you will experience pain. We will give you medication to help minimize the level of pain, but if we gave you enough medicine to take all the pain away, you wouldn't be able to stand up. An important fact is, once you walk up and down the hallway 5 long times, the pain gets less, almost like magic. Second point, your homework is to begin to do normal activity as soon as possible. Your homework is anything a normal person would do in a normal day, we want you to try to do. If you drop a pin, I want you to try to bend over and pick it up. No, you may not be able, most likely you won't be able to pick it up the first time, but at least you know what your homework is. That's your goal. You can walk around the couch, but don't move the couch. We want you going up and down steps. We want you to drive a car as soon as possible. Anything you avoid at the beginning, you'll have difficulty doing later on. A good rule of thumb is, the more you do, the quicker you do, the better you do. Third point, the incision. We've been very lucky with our incisions. As far as minimally invasive surgery is concerned, we've never had a wound problem or infection. We don't want yours to be first. We close the incision with some knotless suture. We then close it with skin glue, and we put a sterile dressing on the top of it. That is designed to stay intact until we see you in the office in 2 weeks. If it comes off or starts to come off, we will give you a number to call. Call us. We will send somebody by your house to change the dressing, or we will have you come by the office and we will change it ourselves. But don't clean it. Don't let anybody else clean it. Fourth point, when we're working with nerves and when we take pressure off the nerves, you may experience some numbness and tingling in the legs. This is normal. As a rule of thumb, it tends to start about 6 days postoperatively and goes away about 10 days postoperatively. Most commonly it's on the left side because most people have numbness on the left side. Just telling you about this in way of warning so that it does not scare you too much. The fifth thing is, you have a direct line to me. If anything comes up, if you have any questions or concerns, call me directly. No question is too small. Even in the hospital, if something comes up you're concerned about, please let me know. If you don't like the food, let me know at the time, and we will send somebody by with some food. It does no good to come by the office in 2 weeks and tell me what happened in the past. Our goal is to make you happy, make your stay as pleasant as possible. By telling us what's going on and giving us the opportunity to correct it, you're not only helping yourself, but you're probably helping the patient that comes after you. No question is too small. The sixth and final thing, given the fact that you're on the schedule to have surgery and you're here today, means that we've already written the order and everything's set for you to go home. You're either scheduled to go home this afternoon or you're scheduled to go home tomorrow. And we do that because we want it to be convenient for you. We don't want you waiting on anybody. And I know that the more you do, the quicker you do, the better you do. So I don't want you laying around. I want you moving. But ultimately, you're welcome to stay as long as you want. All you have to do is notify the nurses, and you're welcome to stay. We'd love to have you. There's no side effects, no consequences with doing that, except one. It does mean that I have to come by and fuss at you a little bit and tell you to start pushing it and move, but I tell you that now with a wink. Otherwise, it's an honor that you chose us to do your surgery. Thank you very much.